here. So, welcome to today's session. My name is Marlene. I'm an implementation specialist here at Accurx, and we also have Dr. Sartori in the call with us today. Amazing. And we also have our lovely support team and implementation team in the Q&A helping us with any questions that you might have throughout today's session. So, as I said, I'm going to get started now and share some of the knowledge that we have. But first and for all, I wanted to go ahead and let you know that it's that time of the year again. Our annual user survey is open. Please scan the QR code and spend 10 minutes after today's webinar to share your current needs and also challenges with the team so we can continue to build user-friendly products for you. To show appreciation for your time today, we're raising the stakes for this year's exciting prizes. We're going to have 3 lucky participants. We're going to earn 3 lucky prizes. So the first prize will be a £1,000 voucher valid at over 100 major retailers such as ASOS, Harvey Nichols, IKEA, Airbnb, and more. Then the second prize will be a team meal on us worth up to £500. And the last one will be a premium package of Accurx merchandise. After completing the survey, you will automatically be entered into the prize draw, and we will announce the winners at the end of the next month. And now, let's go ahead and get started with the session. I wanted to share a quick agenda. First, we'll start with a quick introduction of today's subject, and then we're going to dive into the subject of today's webinar. We're going to show you how we can go ahead and manage, support, I'd say, long-term condition management and how Accurx can go ahead and help you with that. And then we'll focus in particular on diabetes as a specific example. And we'll end the session with a Q&A and share a few more reminders on where you can get support after today's webinar. So what I'm going to be doing now is hand over to Dr. Chris, who's going to be speaking about today's webinar.
Thanks, Marlene. Hi, everyone. My name's Chris. I'm one of the clinical team, and I'm also a GP. And I guess when we think about long-term condition management, there's often really common steps. So across managing all long-term conditions. So things like inviting a patient in for a measurement, an investigation, or a full review, asking the same or a similar set of questions, and then assessing all that information you get back to either alter a treatment plan or maintain and reinforce education and lifestyle measures. And this can be really time consuming for practices, but also for patients, particularly if they have multiple comorbidities. We realize that workflows and how long-term conditions are managed vary from practice to practice. Today, we'll be covering how the individual aspects of Accurx's software can provide a generic functionality that can transform some of the aspects of managing patient care with long-term conditions. The individual elements that you might be familiar with across the Accurx range can also be combined to support a really large proportion of the workflow for certain reviews. And we've got a list here of some of the examples of conditions or elements of care delivery that we can support, whether it's with our questionnaires, templates, the ability to book into an appointment. And there's use cases beyond this where practices have adopted Accurx to support other areas too. And the breadth of this has really opened up with the ability for practices to make their own templates, make their own questionnaires, which we'll talk a little bit about later on. Next slide, nice. It often helps, rather than talking about every long-term condition, to sort of pick one out to give an example of how some of the elements of your patient's management can be delivered in a way that's efficient for the practice, but convenient for the patient. And in a second, Marlene's going to take us through how to do this at scale. So using our batch messaging feature to address the whole cohort at once, but then also what it looks like for the individual patient and what their experience might be. The first thing is sort of collecting data to support annual reviews. So questionnaires are a really powerful tool to gather that structured data. And the questions you find yourself asking your patient in each review, and even measurements. So for diabetes, it might be a BMI or a blood pressure. We know many patients have the means to do this at home already and save the time taken out of an appointment to get these measurements and also these, the answers to these questions. Second part's empowering patients to engage in their care delivery and their plan. So letting them conveniently book a time suitable to them, whether it's for fasting bloods, a foot check, or an entire diabetic review. You can also use reminders to ensure patients don't miss their appointment, but they've also prepared for it. You can customize the reminders to give information ahead of time. So for this blood test, you need to fast, or when you come along, can you bring a urine sample? And we can also use scheduling of messages to act as a future prompt for a re-review, or providing the ability to prompt a next action, be that a repeat HbA1c, or even a series of messages to help patients up titrate metformin if they're starting on that, for example. The third part is provision of information to patients to support their education and self-management. So being able to send a link to a video online or some other online information, or a link to a document that a patient can choose to revisit as they need to. And it's not on a piece of paper that they can easily misplace, can really help support a patient with their self-management and education. So I'll hand over to Marlene now to carry on.
Thank you, Chris. So what I'm going to be doing now is I'm going to go ahead and take you through the specific steps that Chris has just outlined. And I'm going to show you how at each stage you can leverage Accurx to help you manage long-term conditions and ensure a smooth communication process between you and your patients, but also within the practice. So the first step will be gathering information ahead of a diabetic review. The first element is gathering information from a patient in a structured way. We have a diabetic pre-appointment questionnaire available for you, and that covers a lot of the pertinent information you might need ahead of and during the review. You can do these at scale really easily by combining the questionnaires with our batch feature. And then once that's done, what you could do is also gather more specific information for certain patients. And for that, what you can do is use, let's say, our custom templates feature or our questionnaires to support patients in submitting home glucose readings, or also gain consent from them to necessary and onward referrals, like your eye screening referral or any diabetic education program, for instance. Once that's done, we have the second stage, which is empowering your patients to engage in care delivery, ongoing treatment, or just the monitoring that you're going to be doing. For that, for instance, you might want to invite your patients to book directly into the right appointment slots to complete a review. So in that specific, I'd say, case, you could use our self-book features. It could be the individual one or also the batch self-book one for face-to-face appointments. And that will allow the patient to book into the right appointment slot at their convenience. And that could be used for, let's say, a food check appointment, a blood test appointment, or a full diabetic review appointment. Then what you want to do is make sure that every appointment counts and you're using them as efficiently as possible. And what we strongly recommend is that you set up appointment reminders to help reduce DNAs and provide information to your patients ahead of the appointment. So for instance, you could remind them to bring a urine sample, or also remind them to fast before a blood test. And after that, we get to the last stage, which is essentially providing information to support your patient with their own education and also self-management of their condition. You might want to, for instance, give your patients helpful resources that they can reassess as they need. And how we can help with that is essentially, for instance, you have the ability to set up your own SMS templates to provide attachments or links to useful content. For instance, you can send information to your patients around diabetes or around any new medication that they might be taking. You can also instruct them on how to keep a blood sugar diary or even access diet and lifestyle education. And the last thing that you can also do to help your patient is, for instance, plan for future care and tailor that care to a specific patient. And you can, for instance, use our schedule message feature, our questionnaires, and even schedule those questionnaires, as well as our pathways features to prompt future care and monitor according to the patient need. For example, you might want to schedule the diabetes pre-appointment questionnaire for when the next review is due, or you also might want to send a pathway for a repeat blood test. So I feel like I've shared lots of information about that. And what I'm going to be doing now is I'm going to take you through the tools that I've just mentioned so you can see all of these in action. What I'm going to be doing is actually, I'm going to go ahead and move to my clinical system. And as you can see, I need to log into I'm going to go ahead and connect myself to my clinical system. Amazing. So as you can see today, I'm using IMIS, but if you're not using IMIS, please do not panic. Actually, it will work the same even if you're using another clinical system like System 1. And I'm actually not going to be interacting with my system right away. What I need is to make sure that I have my Accurx toolbar over here. So I'm just going to move one of the pop-ups. Amazing. I'm just going to go ahead and make sure that I'm logged in into my Accurx toolbar over here. And I need to make sure that my initials are white, meaning that I can get started with Accurx. And what I'm going to be doing for today's demo is I'm going to start with the large scale that Chris has mentioned. So I'm going to demo how you can go ahead and send a batch questionnaire to a group of patients. And then I'm going to show you how you can use Accurx to interact with a specific patient throughout the session. So I'm going to go ahead and go straight to my initials in my Accurx toolbar, click on my initials, and then click on my second option after my name. So the batch messaging one. And it takes me to this batch message table page, I would say in particular. This is where I need to go to do with anything that has to do with batch messaging. And to get started with sending my batch questionnaire, I need to go into my send a batch option over here, the button, click on it, and I'm taken to this page where I'm asked to choose the type of batch I want to send. The first option that I have is the batch of book one. This is the option to send a book and invite to a group of patients all at once, and this is specifically designed for face-to-face appointments. Then I have these batch message options. So the second one, as you can see, this is more of a one-way conversation for my patients. I'm going to be sending a message and I can also attach a file, and that's essentially it. I'm not expecting to hear back from my patients. And then I have this batch questionnaire option. This is more of a two-way conversation. I'm going to be sending this batch flow rate questionnaire, and I'm expecting to hear back from my patients via the batch flow rate questionnaire. And what I'm going to do is actually pick this option. So now I'm invited to write down my batch questionnaire invites. So I'm going to go to the top and select over here to choose my own questionnaire. So over here, I have at the top of these drop-down list custom questionnaires. These are questionnaires that have been created by my practice, and I can pick any of them. But what I'm going to be doing is scrolling down to be able to find questionnaires that have already been created by Accurx. So as you can see here, I have the ones that have been created by Accurx, and I also have subcategories over here. So it's easier for me to find the ones that I want. So I'm going to scroll down to the chronic ones over here and select this diabetes pre-appointment questionnaire. Amazing. Now that's done, if you look at to this text box over here, I already have some text that has been added. If I want, I can go ahead and add more information, more text. As you can see, it's a free text box. However, what I would advise you to do is make sure that your text is short and concise and targeted to the patients you're going to be messaging, especially if you want to be mindful of SMS costs and you are trying to reduce them. Essentially, the longer your text message is, the more costly your text message might be. And if you are in doubt, we also have warnings over here for you, letting you know that your message is a bit lengthy and you might want to reduce that text message. Also, if you look over here, this is where we're going to be adding the link so your patients can go ahead and click and start filling out the questionnaire. Then we also have this option over here. This allows you to basically save or not save the body of the message to the patient's record. If you don't want to save the body of the message, all you need to do is untick this box over here. And what's going to be saved to the patient's record is the fact that you are sending a batch questionnaire, the patient's contact details, and also the SNOMED code that you have over here. In my specific case, I'm already using a pre-made template. So essentially the SNOMED code is already chosen for me, has already been chosen. But if it's not the case, you will have the option to choose your own SNOMED code. And also when you choose one and when you are sending a questionnaire with a SNOMED code, we'll let you know when the code will be saved to the patient's record. In my specific case for this questionnaire, this will be saved when I send the questionnaire invite. So I'm going to make sure that I tick this. I want to save this to the patient's records. And the last thing that's quite important over here is this option to assign the responses. So because you're expecting to hear back from your patients, you have a dedicated folder in your Accurx inbox where you can go ahead and find the patient's responses. In this specific case, the default folder is the diabetes folder in your Accurx inbox. But if you want, you can click and you can choose another one. So as you can see here, I have a drop-down list and I have lots of options. So I think I'm going to leave it to the default one, the diabetes one. But if you are looking for a folder and you don't have one, you can always go ahead and get in touch with us, and we're going to be happy to create a folder for your Accurx inbox as well. So I'm going to go ahead and, as I said, I'm going to choose this one. Now, I think I'm happy with everything I've chosen so far. What I'm going to be doing is go to the next step by adding a patient list and clicking over here at the bottom. So I'm going to click. And I'm taken to this page where I'm asked to upload a CSV file with my patient's information. So over here, I'm told what I need to have in that CSV file. If you've never done this before, you do have some helpful tips over here for you on how to extract this file from your clinical system. And also, we have some information on how messaging your patients via batch messaging works. When it comes to sending a batch message and a batch questionnaire, you do have quite a few options when it comes to getting in touch with your patients. The first one is the ability to send an email to your patients instead of sending a text message. So this is the first thing that we're going to try and do if you include an email in the CSV file. If you don't include an email, what we're going to be doing is actually skipping this step, and we're going to go to the second one, which is attempting to sending a message via the NHS app. However, this is only done under two conditions. The patients need to have the NHS app downloaded, and they have to have the push notifications for the NHS app switch on. If they are fulfilling these two conditions, we're going to be sending the message via the app, and they're going to have 24 hours to read the message in the app. And if they don't read the message in the app within that time frame, so the 24 hours, we're going to be sending the message via SMS instead to make sure that the message is not missed by the patient. And the other thing as well that's quite important is, as I said, we only attempt to send a message via the NHS app if the patients have the NHS app downloaded and the push notifications for the app switch on. If they don't have these two conditions, we're going to be skipping this step, and we're going to go straight to sending a text message to the patient as normal if the patient has a valid UK mobile number. So I hope this is clear. And what I'm going to be doing now is just adding my patient needs to be able to send my questionnaire. So I'm going to go back to the top and click over here to upload my CSV file. So I'm going to click and select this one. Amazing. The information has been uploaded into my Accurx system. So as you can see here, I have 8 patients on my list. So this is the number that I tend to message. However, I can see that only 6 out of 8 have been accepted by my Accurx system. And if I click to view more details over here, I can see that I have all of the right details to be able to contact them. And so I'm just going to close this. And I can see that 2 of my 8 patients cannot be contacted. And again, if I click to view more details, I can see that I don't have the right contact details to be able to reach out to them. If that happens to you, please do not worry. What you can do is always click over here to download a new list. And then what you can do is try and get up-to-date contact details for those patients that cannot be contacted. If you're happy to proceed and message the ones that have been accepted by the Accurx system, what you can do is click continue. And then we ask you if you want to be sending this batch questionnaire now or if you want to schedule it for the future. If you want to schedule, you can click a later time over here, and then you can choose any date and time that works for you. So I'm going to pick these days, for instance. And you also have the option to stagger the sending of the batch questionnaire. This is quite helpful if you have a large, let's say, list of patients to contact, let's say 500. You might not want to hear back from the patients all at once. So it's quite helpful for you to make sure that you're staggering the sending. And all you need to do is switch this on over here. And then you can choose how many days you want to stagger the sending over. So you can choose how many days you want. The only thing that you need to be mindful of is that the maximum number of days you can stagger the sending of a batch questionnaire and a batch message is how many patients you have in your list. In my particular case, I only have 6 patients to message, so I can only stagger for 6 days at a maximum. But if you had 500 patients, the maximum number of days would be 500. And we also let you know over here how many patients will be messaged a day. So If you're happy with these, you can go ahead and proceed to the next step by clicking review. And then we ask you to review the message essentially that you're going to be sending, making sure that everything is all right. And once that's done, you can click confirm and save. Amazing. So as you can see, we do have our annual user survey. I'm going to delete this for now. And over here, I have my confirmation. But if anything, you can always scroll down and review the batch table over here, where you can see the status for each batch that you're going to be sending. Over here, you can see whether or not the batch has been sent, if it's sending, and also if it's scheduled. And if you want, you can click over here to view more details and have more details for each batch message. Amazing. So I'm going to go ahead and close this now. And what I'm going to be doing is I'm going to show you how it looks like from the patient side. I've sent a questionnaire to my own test patient earlier, and I'm going to open this page, as you can see. So what I've done is that I click in the link in the text message, and this is what it looks like for a patient. They have to put their date of birth over here to verify their identity. So I'm just putting my test patient's details. I'm going to confirm now, and I'm taken to the conversation portal. So I can review the message that has been sent to me. And over here, I can clearly see that the questionnaire will be expired in 7 days. And indeed, whenever you send a questionnaire link to your patients, they are valid for 7 days. Once that's done, I think I'm ready to go ahead and start filling out my questionnaire. So over here, I just have a quick introduction to my questionnaire. I'm told the purpose of this questionnaire, which is gather lifestyle and health habits information ahead of the review and anything that might affect my diabetes. Once I'm ready, I'm going to click continue, and then I'm asked one question and one answer per page. The first one is asking me if I drink alcohol. I can put down no, click continue. Then the second one is regarding my smoking status, asking me, for instance, if I'm a current smoker, ex-smoker, or if I've never smoked. I'm going to choose current smoker. Then I'm asked how much I smoke, let's say a medium amount. Click continue. And then I'm in the next section of my questionnaire. Before I proceed, I just wanted to let you know that if you look here at the top, I have a progress bar letting me know as a patient how far along I am for this questionnaire to be done. And this is quite helpful to make sure that your patients don't give up on the questionnaire as well. I'm going to go ahead and proceed. And this next section will be about my weight and also my blood pressure. This is essentially letting me know that I'm going to be asked to submit my values over here. But if I don't know the answer to these questions, I can skip them as well. So I'm going to click continue to proceed. And now I'm asked if I know my weights. I can put down yes. And let's put down 80 kilos over here. And then the next question is about my height. If I know my height, I can put down yes, I do know my height. And also put again the measurements over here. Let's put 180 and then click continue. And this next question is asking me if I'm able to provide my blood pressure reading. So I can put down yes over here. And when I choose yes, I'm given some guidance on how to take my blood pressure reading at home and also what to do if I'm experiencing any urgent medical symptoms. And again, after that, I can proceed and I can go ahead and share my blood pressure reading. So I'm going to put down 125 for this one and then put down 84 and click continue to proceed. And then in this next question, I'm asked if I'm having any side effects or problems with my medication. If it's the case, if I want to discuss this in the upcoming review. So I can put down no, I'm not having any issues. If I put down yes, I'm going to be asked another question where I can provide more details. So I'm going to click continue to proceed. And in this one, I'm asked if I'm having yearly diabetes eye checkups. Again, I can put down yes for this one. This next one is asking me if I'm having any issues with my sexual function. And if I do, if I'd like to discuss this in the upcoming appointment, I can put down yes or no. Again, if I put down yes, I'm asked for more details. I can click continue. And then over here, I'm asked questions on whether the diabetes is affecting my mental health, if I'm having any issues with my mood, for instance. And again, if I'd like to discuss this in the upcoming appointment. So I can put yes or no. I'm going to put no for now. Go to the next one. And here I'm asked if I'm aware of my sick day rules, if I'm aware that I might need to make any changes to my medication. So I can put down yes, that I'm aware of my sick day rules over here and click continue. And then this is the last question of my questionnaire, where I'm asked if there's anything else that has not been mentioned so far that I'd like to discuss as well. So this is a free text box. I can put anything I'd like to as a patient to make sure that nothing gets missed. And once I'm ready, I can click continue. And over here, I'm just asked to review my answers. If I need to change anything, I can go back. If not, I can click submit. And I'm taken to this confirmation page where at the top, I'm told what's going to happen next. This is great to manage your patient's expectations. Then we do have over here some information on what to bring to the upcoming diabetes appointment. And also I have more information on diabetes. And because I've also put down that I'm a current smoker, over here I have some information on smoking cessation advice. One thing that also I need to let you know before I move to the next step of today's demo is that when you are sending a questionnaire to your patients, we're going to be sending reminders to your patients via SMS if the patient doesn't complete the questionnaire. So we're going to be sending a reminder on day 3 and day 6 before the link for the questionnaire expires on day 7. And as I said, these reminders are sent via SMS, even if the initial invite is sent via the NHS app. So yeah, now what I'm going to be doing is I'm going to close this and I'm going to log in into my clinical system and I'm going to show you how it looks like when you receive a patient response and how you can manage that response and also interact with your patient um, regarding the review. So I'm going to click on my inbox over here. And as I said, you're going to have a specific folder where you can find your patient's responses. For the diabetes one, the default one will be the diabetes folder that can be found over here. And also, just to let you know, my inbox is looking a bit different because this is going to be the new inbox. So please don't be alarmed if you don't have access to this new inbox. You're going to have access to this inbox soon. And anything that I'm going to be going through today, you already have access in your current inbox if it doesn't look like mine right now. So yeah. So as I was saying, you can find your responses under the questionnaires folder, and I already have the diabetes folder over here. But because I've sent it to my own test patient and I'm not using a real number, I have the response in my own inbox because it's coming as a failed message. So as you can see here, this is the initial message I've sent. I have over here the patient response, and I can go ahead, review, see if it's urgent, if it needs to be picked up sooner, and then I can click save to record to make sure that everything is saved and I have a clear audit trail. And if I go into the record, I can also find all of this information. And once that's done, once it's saved, I can click reply to the patient. And then, as I imagine, you could go ahead and write your text message or even use, let's say, templates. I'm going to go ahead and select this template over here. And I'm going to confirm I want this template. Amazing. And let's say you actually need to bring this patient up for review. What you could do is choose to send a self-book invite. So I'm going to go ahead and click to add an individual self-book invite over here. And I can build my invite in this page. So over here, the first thing that I can do is choose whether or not I want to invite the patient for review in my upcoming, in my practice, or if I want to choose another organization, I can do so. I'm going to leave it to my own practice over here, and then I can choose the appointment type as well. So if it's a face-to-face appointment, the patient will have the option to choose an exact appointment time, or if it's a telephone one, the patient can choose morning or afternoon slots. I'm going to leave it to face-to-face because it's more appropriate for the subject of today's webinar. And then I can go ahead and click to choose a slot. So there's two things that you need to know. The first one is over here, I can choose any of the slots, and these slots, you don't need to do anything to have them over here in this drop-down list. They are automatically pulled from your appointments book because we are already connected to your appointments book. And the second thing is that whenever you choose a specific slot, patients can only see appointments for that slot. They cannot see any other slots or appointments in your appointments book. I'm going to go ahead and choose this diabetic review over here, but also, as you can see here, I could choose to send a self-book link to invite my patients for a blood test or also a diabetic foot check. So I'm going to choose this one, as I said, but you do have quite a lot of options. You can use it for any slot, essentially. And then over here, I can also choose whether I want to invite my patients for an appointment with any clinician, any session holder for that specific slot, or if I want to have my patients only booking an appointment with a specific clinician. So I need to select this option, and then if I click in the search box, I can choose the clinician. So I'm gonna go ahead and choose this one. Amazing. And I'm gonna add my self-book invite right now. Amazing. So I do have this nomad code over here, but I have over here information about my self-book invites, and I'm going to go ahead and send it to you, actually to myself, my test patient. And I'm going to click over here, and I'm taken back to my patient page. Again, as I did before, I have to verify my identity as a patient. Amazing. I'm going to confirm. I'm taken back to my conversation portal, and over here I can see the initial message that has been sent to me, inviting me to fill out the questionnaire. I can view the questionnaire response over here. Then I can see the follow-up where I'm invited to book a diabetic review over here. And as with the questionnaire, my link for a self-book invite is valid for 7 days. So clearly over here, I'm told that this invite will be expiring on a specific date. And then when I'm ready, I can click to get started with booking my appointment. Amazing. And over here, I can view all of the appointments that are available for myself to book. One thing that is quite important for you also to know in this particular step is that patients can view up to I'd say 6 to 12 weeks of appointments for that specific slot that you have chosen to share with them. If you have, let's say, embargoed any appointments in that slots, patients should not be able to view the embargo appointments. They can only see what you choose to share with them. For my specific case, I can only see these appointments, as you can see. And I'm going to choose, let's say, this one for my review. Click review over here. And I just need to review again my choices to make sure they work for me. And once that's done, I can click confirm. And now this is being confirmed in my practice. The appointment book is being checked. And once it's done, I'm going to be taken to the confirmation page. So again, I'm in the conversation portal. And if I scroll down, I can go ahead and confirm that my appointment has been booked. What I would also recommend is making sure that you're setting appointment reminders to help your patients with reminding again, like making sure that they don't miss the appointment. And as I said, you can add extra information into the appointment reminders. And as a patient, what I can do is click over here to add these to my electronic calendar, making sure I don't forget about this appointment as well. So, hope this has been helpful. What I'm going to be doing now is again closing these and actually going to be closing these. And I'm going to take you through the other step, which is planning ahead, for instance, and the tools that you can use. Let's say now you've had your review with your patient and you have increased your patient's medication. You might want to, for instance, schedule a questionnaire ahead of the next review. You might want to send a SMS template or even schedule that text message. But also what you can do is use pathways. And I'm aware that all of you might not be familiar with the idea of pathways. If you've never heard about these before, it's essentially the ability for you to send multiple text messages to the same patient over a specific period of time. And instead of just talking, I'm going to go ahead and share this with you. So if I want to send a pathway, what I can do is click in this message icon over here. And I have my composer message box. I'm just going to move it to the middle. And instead of just writing a text message, I'm going to start by clicking on the search box and then selecting this pathway option over here. And I should be able to view all of the pathways that have already been created by Accurx. This is really great to send reminders to your patients for medication changes or blood tests or anything. Let's say you can go ahead and do one for metformin over here, as you can see. But what I'm going to be doing is actually send a reminder for a blood test. I'm going to choose this one. I'm going to click preview. Oh, actually, no, I've selected this one. And as I said, Pathways allows you to send multiple text messages. So over here, I have my first text message. It's saying 1 out of 2. And over here, I have the second text message, 2 out of 2. And the first one is just reminding my patient that they'll need to book a blood test in a few weeks. And the second one is just checking in with my patient, asking them if they have booked the blood test. And the difference between these two is that the first one will be sent now, and the second one will be sent in 12 weeks. As you can see, it's already automatically scheduled for that time. So I can go ahead and also interact with my patient in normal ways, as if I'm just sending a normal SMS, because I can still go ahead and allow the patient to respond to my text message. And if I want to, sorry, I'm scrolling a bit too fast. So if I want to, let's say I'm gonna remove this one, I can also attach a file from my desktop, my clinical system, or even an NHS.UK website. So let's say I'm gonna choose a diabetes one for this case. I'm going to choose this one. And as you can see, I can still add it to my message as normal. So once I'm ready, I can go ahead and send this to my patient, save it to the record, and that's it. So the first one will be sent now, and the second one will be scheduled. If I don't want to be using one that has been created by Accurx, I can go ahead and build my own custom pathways. So what I've done is, again, I went ahead and clicked on my message icon over here. And to build your own custom pathway, what you can do is, let's say, write your own message or select a template as well in the search box over here. And once that's done, you can go ahead and add your second message by clicking on the plus sign over here at the bottom of my box. I'm going to click on the plus, and as you can see, I have a second message that has appeared. And again, I can just go ahead and write my message. And actually, you don't have to restrict yourself to 2 messages. If you want, you can go ahead and add as many messages as you need. And then all you would need to do is choose when you are sending the messages. So let's say the first one, I want to send it now. Then the second one, I can go ahead and choose any date and time that would work for me. And I can do the same for the third one over here. So let's say I'm going to do this, and I'm going to choose this date, for instance, and time, and that's it. And then I can do the same one for all of the other messages that I want to schedule. So yeah, I hope this has been quite helpful. What I'm going to be doing now is actually stop demoing, and I'm going to hand over to Chris. So I'm just going to dismiss this, and I'm going to hand over to Chris, who's going to be talking a bit more about the other ways that you can also, I would say, other tools that you can use to help you manage the diabetes review.
Thanks, Marlene. So yeah, I think it's important to mention that like these features support the long-term condition management rather than kind of entirely replacing the review. But by optimizing certain areas of the journey, you can liberate more time for specific patients or aspects of care that sort of need a bit more of a focus. So things like talking about lifestyle measures, smoking cessation, mood or sexual dysfunction, and these can be covered in greater depth and hopefully drive a bit more meaningful behavior change or address quality of life. In terms of we've got other tips and other features here that help manage long-term conditions. Beyond us having sort of a bunch of other features to help with other long-term conditions in a similar way, be that asthma with the ACT or a blood pressure questionnaire, there are other tools to help manage long-term conditions. So patient triage, for example, perhaps it's the development of an ulcer in a patient who has diabetes or an increase in their hypos or whatever it might be. But by giving the patients tools to easily reach out as they need to, it stops the behavior of waiting until the next review to bring up something that perhaps needs a bit of earlier intervention. And establishing these easy to contact pathways are really, really crucial for in-between reviews. You can also use our Accurx feature. And this is a feature that's used to communicate with other healthcare professionals in the same way that you might message a patient. You can send an email to another healthcare professional instantly and save everything back to the record, and it's accessed by the little @ sign on the toolbar. This could be used to make a referral, for ask for specialist advice and guidance, or liaising with a pharmacy about a change in regime or drug. In terms of general tips to help with sort of patient engagement, we've heard a lot from practices about how important it is to make your patient's messages really personable and human. So practices have found responses and engagement to be a lot higher when a named clinician signs off the batch rather than just the name of the organisation or practice. Also, like addressing the patient and then putting information about the importance of the review, for example. I understand there's a lot to go in, and there's a focus on not taking up too many fragments to get the message across, but having this kind of important stuff really drives engagement and could end up stopping another message having to go out to try and re-engage a patient. Looking beyond, again, this example of diabetes care, we've also had some feedback that some of the harder to reach patients often really respond more to delivering care in this way. So patients with really busy schedules or perhaps mental health issues, particularly those maybe on your serious mental illness register, can often engage better when delivering care in this way. And it creates a mechanism to capture holistic physical data parameters, for example, smoking status, BMI, blood pressure, which is of particular interest in this group of patients. And a group who particularly might not feel able to attend the surgery or not have the same confidence. So we've also found that practices who use Accurx questionnaires alongside their own created questionnaires and appropriate slots and templates can manage overlapping conditions. So whether that be ischemic heart disease, hypertension, diabetes, chronic kidney disease, into one more comprehensive review. And this is sort of another stage forward, progressing the long-term condition management to the next stage and tackling multiple elements all at once is sort of a representation of this. But it saves the patient being invited sort of multiple times for multiple reviews in isolation, and it can save the practice time and appointments and also prevent disengagement. Often a really great way to learn more about managing long-term conditions, among loads of other things in really innovative ways, is to connect with other GP colleagues who have tried and established ways of using our products in really useful ways. We've got a wide community of colleagues who make custom questionnaires, and they're really happy to share them because they can share their entire libraries with just a link that you can review and you can import into your own practice to use. And we've got a community that you can actually join and benefit from some of this sort of shared knowledge. But I'm going to hand over to Marlene now, who's going to let you know a little bit more about the Accurx community.
Thank you, Chris. Yes, so I'm going to share some bits of information. The first thing is, if you need help after today's session, please don't hesitate to reach out to our support team via the live chat and also via email at support@accurx.com. This can be great, especially if you are having any urgent queries or technical issues. Also, if you have any questions on training, what you can do is contact my team at customer.success@Accurx, and we can help out with any training queries. And also, if you don't have access to any of the features that I've mentioned today, and you'd like to have access to those features, what you can do is reach out to our partnerships team at partnerships@accurx.com. And as Chris has mentioned, we do have a community. So I'd like to invite you all to join our GP community to remain updated on Accurx news, ask questions, and share best practice with peers from across the country. All you need to do is scan the QR code to explore the upcoming events, both in person and virtual events, and also connect with us on WhatsApp, Facebook to join the conversation. And a bit like what Chris has said, we're going to have one of our community members, Dr. Dave Twiska, who has previously shared his questionnaires library in our community. We're going to ask him to share that again with you. So all you need to do is just join today by scanning the QR code. And I'm looking forward to seeing you all in the Facebook community and WhatsApp community. What we're going to be doing now is actually opening up for questions. So I'm just going to go ahead and have a look at some of the questions that you have asked throughout the webinar. And yeah, do our best to help you out with those questions. So I'm just going to go ahead. So I had here a question. The first one is, are we able to pick up the BP EMIS QOF code question by getting them to reach out to us? Oh, sorry. No, I don't think this is a question, but I think there has been some questions regarding the blood pressure EMIS QOF code.
Yeah, we're going to pick that up separately, Marlene. I'm going to reach out to the people who've messaged about that and to try and dig into what they're struggling with.
Amazing, that's really helpful. Thank you, Chris. And then the next question that I have here is the number of characters on the appointment reminders is very limited to add supportive information for the appointment. Is there a plan to review the character limit? So, yeah, I would say that we do have a high volume of reminders that are sent, and the character limit is set to 2 fragments to help reduce with the high SMS costs that can create. What I could advise you to do is actually to link out more information in that specific appointment reminder that you want to create. And also don't forget to use URL shortness. For instance, we can use Bitly. I can also share that afterwards, but basically that will enable you to shorten the link to make sure that, again, the text message is not too lengthy and, again, helps you reduce SMS costs. Hope this is quite helpful. And then we do have another question. So is there a way to send a self-book link and a questionnaire at the same time? Yeah, so that's a good question. We don't have the functionality available right now, but we could look into that as an option. I'm going to make sure that this is shared with our teams here at Accurx. And we also look into allowing attachments to be shared when you're sending a self-book message. Then we do have another question. So asking if it's possible to edit questionnaires like the ACT and COPD questionnaires. So at the moment, I know that it's not possible to amend those Accurx made questionnaires, but what you can always do is create your own custom questionnaires. If you want, you can use some of the questions over there, but that would give you a bit more of freedom to create what works best for you as a practice and also your patients. So, sorry, I'm just going to look into more questions. Okay, so I have a question regarding whether or not we can send the same batch message again to help with recall. I think I'm going to let you take that one, Chris, if that's okay.
Yeah, sure. So, so this question's about whether or not we can use exactly or resend exactly the same batch message to help with recall or re-engagement with patients. I think whilst you can't trigger a batch message to send again an exact same message to send again to the same CSV, we have a couple of really useful features. So once a batch message has been sent, you can see who it's been delivered to and the patient cohort, the number of patients it's been delivered to, but also the patients that it's failed to deliver to. So you can really target and check maybe the contact details that you've got for those patients and reach out to them in another way, or update the contact details and try again. So we have the ability to sort of filter out those CSVs and to make sure that you're reaching a whole cohort. Once you've sort of addressed the whole cohort, I guess, rather than sending it to exactly the same CSV, again, your diabetic cohort might be really dynamic, first of all, in terms of number one, who actually needs a review. There might be new patients with diabetes who come onto the list who require an invitation for a review or a self-book or a Floria, whatever it might be. And you might have patients who drop off the list, and that might be because they're perhaps in remission or they've actually had their review for that year. So because the list is dynamic, I would probably recommend that you actually use your search that you have to pull that cohort of patients as your source of truth, to then carry out the next message that you need to send.
Thank you, Chris. And then I'm just going to check for more questions. So, excuse me. The next question is, if the patient responds to the first reminder, does the system stop sending the second scheduled one? So the answer to that is yes, there will not be sent any further reminders if they have completed the questionnaire. So as I said, the reminders are only sent if the patient has not completed the questionnaire before the link expires on day 7. And again, I'm just going to check if there are any other questions we can help you with.
We had a question about adding in blood glucose measurements into the diabetic pre-appointment questionnaire. I think there's a couple of elements of difficulty with this, in that number one, not every patient who has diabetes will have the mechanism to submit blood glucose readings. So we try and keep the review questionnaires that we build as sort of general and broadly applicable as possible. The other thing, I guess, is that to collect or maintain a blood sugar diary is a thing that's done over multiple days, and the Flory is something that really, hopefully, can be answered in a much relatively shorter time frame. If there's any specific information, I guess there's the free text box at the end of the diabetic pre-appointment questionnaire, which says if there's anything else you want to mention about your diabetes care, and you could actually put in the invite message to prompt to put something in there. Or as we suggested earlier, there are mechanisms to reach out to a patient, and if they've got, I don't know, continuous blood glucose monitoring and want to send some images or documents or downloads, they can attach those to responses that you might send to a patient separately. Or if you wanted to create your own questionnaire so that a patient can fill it in over the course of a week, for example, then you can do that.
Amazing. Thank you, Chris. Again, feel free to keep on sharing any questions you might have. So I have one question here from Alexandra asking if I send a pathway message and a patient books a blood test, for example, either via self-book or via the receptionist. Do the rest of the pathway messages auto-cancel or need manually cancelling? So please correct me if I'm wrong, Chris, but I would say that you would need to manually cancel the message as it's not necessarily linked to your self-book feature. So you would need to go ahead and look for the patient's conversation, for instance, in your inbox and cancel the message itself.
Yeah, I think there's no link between the next message automatically cancelling based on a booking. I guess the other thing is that bookings can be fluctuant and can be cancelled and changed and rescheduled, and having that second message is there to serve as a prompt. I think the way that I would word if I was messaging out to a patient and say, you know, I'd like you to book this intervention, and then the second message I would always sort of phrase as a reminder, or if you haven't booked this yet, this is just a reminder, so that it doesn't cause confusion about perhaps them thinking they have to book a second appointment when they don't.
Thank you so much, Chris. Again, keep sharing any questions you might have regarding managing long-term conditions with Accurx and how Accurx can support you with the communication of the management of those conditions. I can see there's a few questions popping up. So, sorry, Chris, do you want to go?
I was going to say there's just going through a couple of these. There's one about, is there an option to put a questionnaire on a website for self-help? I think because all of our questionnaires at the moment are intrinsically linked to a specific patient, and that's why you get the answers that come back in and it matches to a patient in your record, and you can save it to the record and have that thread that's been established. There isn't a way to have a generic sort of questionnaire at the moment, although we're looking into like patient access and how patients access the practice through our patient initiated forms at the moment. So a patient, if they needed to get in contact, they could use the patient triage form. The other thing is that we've often found that the control of information and flow that wants to come into the practice is often really wants to be in the hands of the clinician to say, actually, I want this, or I'm requested, or I know that you need to have this bit of information. If you think that there's something that a patient will need to fill in future, and where you might be like, oh, actually, I'd like to, you know, check your blood pressure in 6 months, and that was the idea of going online and filling in a blood pressure questionnaire, for example. You can actually just schedule the questionnaire so that at that interval that you think is appropriate for the next bit of care to be picked up, you can then schedule it for that, so the patient will receive it in 6 months' time, for example.
Thank you, Chris. I have one last question that I think maybe you could help with. There's a question asking what to do, for instance, if patients have multiple conditions, how to best recall them.
Yeah, I think this is a real challenge, and you also get there's also patients who have a you'll have like January is going to be this condition, and then March is this, and June, etc. So actually getting the temporal element is one thing, and what we often find is moving those reviews to try and align them together at a point where you sort of establish a time of year where this is the review that's going to happen. When you're sending out booking links, making sure that actually the slots that you have, that there are a couple that maybe you customize to account for patients who might need to have, you know, their hypertension and asthma or whatever it might be that overlaps reviewed in one go. There's not the option right now to combine like questionnaires into one long questionnaire, but you can trigger and send multiple questionnaires to line up with those appointments, and then being received in sort of in succession is sometimes a little bit easier than doing it over a long period of time. Like I said, in terms of our sort of wider community of GPs, some of them have created some questionnaires that kind of try to address these multiple overlaps of different conditions. And we also see that some people repurpose, for example, our health check questionnaire to gather some really useful information across a sort of broad spectrum of that kind of cardiovascular risk. So yeah, just there's some ideas there.
Yeah, that's really helpful. Thank you so much, Chris. I know that we are at time and there's still a few questions popping up. As I said, you can always reach out to us via the email. So I'm going to share the slides again with you, the email addresses that we've shared over here. Also, just I know that we are at time, so I'd love to actually gather feedback from you on how you found this webinar and how we could go ahead and build more sessions like these that could be quite helpful. So I'm just going to go ahead and launch a poll. It should be showing up in your screens right now. So all I need is just a few minutes of your time just to know how we can improve these sessions for you and make them more helpful. And if you have to go, I want to I think thank you won't be enough, but I really want to like thank you so much for your time, for attending today's session, and I hope you have the best day ever. And as I said, don't hesitate to reach out to us if you have more questions. So the slides actually for the questions, it's not this one, is this one. Yeah. Again, thank you so much for your time. I really hope this session was helpful. And thank you so much to Chris for helping out with any clinical information and the questions. And also thank you for to the support team and the implementation team for helping out throughout today's session as well. Yeah, thank you so much.